Hi everybody. I wanted to make a video about something that I saw on the website called Gossip Bakery under the Glenda Sully subcategory, I guess you could say. And this comment really pisses me off. And I'm going to tell you why. This is the comment. Is it backwards? I don't know. I'll read it. From Paige Matheson, whoever that is, I don't know. But it says, also, this may not be a popular opinion, but I'm tired of Miss Nurse of America going on about how nurses need help. We take care of you, and now we need your help. I'm sorry, but this was your chosen profession. Yes, it was brave that nurses didn't quit when COVID hit, but acting like they should be awarded every day is ridiculous. Doctors don't do this. What about police officers who literally don't know if they're, I cut it off, but it's, I guess, coming home at night? Paige, are you aware that last week a nurse was physically assaulted by a patient for 30 minutes straight and subsequently hospitalized with a head injury? And this nurse was told to not file criminal charges against the patient. Nurses have been physically assaulted by patients. It's crazy. And this is what I mean by nurses need help. Nurses need help, doctors need, healthcare workers need help. Now, Paige, I'm gonna say that you probably never worked in healthcare, so you wouldn't know this, but I challenge you to go to any hospital and do what a nurse does for one shift. Yeah, half a shift. You wouldn't be able to do it. I've been a nurse for over 33 years. I was around with the AIDS crisis when nobody knew to do anything else except wear 2 pairs of gloves because we didn't know how it was transmitted, or I've been around a long time. And you're actually right that this was the chosen profession, but where in that chosen profession does it say that I signed up to be verbally or physically assaulted by patients and or patients' families? I had a gun pulled on me when I worked in the emergency room. And that's going back, my God, into the early 90s. So if you think that police officers are the only ones that go to work wondering if they're going to come home at night, you're wrong. And this proves that the general public has no idea what's going on out there. Would you want to be a patient in an ICU nowadays when you know that there are at least 4 critical patients that one nurse is taking care of in an ICU? Would you want to be one of those 4 patients? I know I wouldn't. I've worked in ICU. I worked in ICU when it was a 1-to-1 or 1-to-2 ratio, not 1-to-4. And my mother has been in the hospital a couple times in the past couple of years. She was in the hospital at the height of COVID. She was in the hospital again in March. The nurses today are working much, much harder than I did decades ago. Hospitals have been taken over by corporate enterprises whose priority is to make money for shareholders. Your health care has been reduced to a line item in a budget. And nurses are being so overworked that it is unsafe for the patients. We already have hospitals coming out, or not hospitals coming out, but the word coming out of hospitals where patients are dying. There was one hospital in North Carolina where somebody died in the emergency room. Oh, actually, no, it was Yale New Haven, where they brought a patient into the emergency room who was found overdosed on heroin in the field. They gave him Narcan in the field, brought him to Yale New Haven's emergency room, and the guy died laying in the hallway in the emergency room because they were so short-staffed that there was nobody to check on this guy. They had no idea when he died because he looked like he was sleeping. And then after, there was a 7-hour period where nothing is recorded in the nursing notes because they don't have enough nurses. And Yale New Haven is a level 1 trauma center. So guess what? When you have heart attacks coming in, when you have traumas coming in, when you have strokes, they get priority, and there's nobody left to watch these people that are just kind of under observation. Nobody's observing them because they can't. How can you observe somebody in a hallway if you're in a trauma room doing chest compressions on somebody that was just hit by a truck? So before you make statements like this, you may want to go and do a little bit of research. The CEOs of hospital systems are pulling in 10, 20, 30, $100 million a year. And when COVID hit and nurses were getting sick, this and that, they relied on travel agencies who were commanding a really, really, really high wage. Now, we're still considered to be in a pandemic, but hospitals have decided that they don't want to utilize traveling nurses anymore because they cost too much. So, these hospitals are running on skeleton staff at best. And I feel sorry for you if you ever have to go into the emergency room for something besides a life-threatening or limb-threatening condition. Say if you break your leg or something, you're going to wait for hours in the waiting room with your broken arm, leg, whatever it happens to be. If you have a laceration that needs sutures, you're going to wait for hours because there aren't enough staff. And that goes for nurses, for doctors, for support staff. That's across the board. Hospitals don't have enough staff to take care of people. So, I didn't say that nurses should be awarded every day. What nurses are trying to do is get legislators to pass bills for mandatory nurse-patient ratios so you don't have one nurse taking care of 26 patients. In long-term care facilities, there's usually 2 nurses for about 80 patients. Really? So if you can tell me how you can safely take care of 40 patients in 8 or 12 hours, I'd love to hear it, because us nurses still can't figure it out. So with your divine wisdom that calling me Miss Nurse of America, I'm certainly not Miss Nurse of America, but you know what? All I know is that healthcare cannot continue to go on the way it is. It's not sustainable the way it is right now. And it's going to get worse before it gets better. And statements like this prove that you don't know what the hell you're talking about. Doctors don't do this. Doctors are leaving in droves. If they're young enough to step into another career path, they're leaving. But the ones that are my age, they're already too invested in it to go back and do anything else, so they're stuck. And they all hate it. So be a little smarter before you post ridiculous, police officers. But you know what? They go into that accepting that risk too. So that kind of nullifies your argument. Have a great day, Paige.